Is Veronique there? I can't see Veronique.
I have not seen her yet.
Yeah, maybe she's not there. I don't know where she is. But anyhow, I think we can start now. Is it okay for you? My name is Pirkko Kouri and I will chair this special roundtable and we can share some ideas. And first presentation is 1 minute.
Recording in progress.
Okay, now you have the recording. So maybe we start with the Claudia. You are ready there already? Claudia? If we start with you.
Yes.
Yes, please.
I don't have any...
Okay, but
yes.
If you just discuss about the research where nurses are the first authors, please. You are not in the camera, only half of your face is in camera.
Okay.
You can just move a little bit the camera, please.
Oh, I can see myself fine. Oh, I see what you're saying.
Anyhow, you can start.
I don't have any slides. I'm just going to talk. I will just talk like 5 minutes. I'm a retired nurse and I am still involved with telehealth and telehealth nursing, obviously, from participation in this panel. And for about the last 6 years, I have been collecting the literature that represents nurse as first author research. And what I have found is that nurses are very involved in telehealth and very productive in terms of publication. And I would like to just make some comments about successful research and successful publication. One, we tend to take too much at one time in terms of research. It should be a topic that is of great interest to the researcher and then has the ability to be taken from start to finish, from idea to publication and dissemination, if you will. And in order to do this, I strongly encourage researchers, female researchers, nurse researchers, since that's my background, to develop a team with whom to work. It's very difficult to do research alone. From having the idea to actually publishing the results of your findings in a refereed journal. It's also a very good idea to have a mentor who can guide you along the way. And preferably this mentor isn't someone that you work for or directly for. I appreciate that different countries are different in terms of structure, but generally a mentor should be someone with whom you can talk freely and who is willing to give you advice and guidance without involving the idea of evaluating how you're doing your current job. So you identify your interest, and the reason it should be interest, something important to you, is that you're going to be spending a lot of time with it. And you'll probably have to defend, if you're in an academic program, you would defend with your faculty. But if you're in a clinical setting or some other work employment setting, you'll have to defend why you're spending time doing the research. So that's a key point. Another thing that I see when I read your publications is that we're sometimes not sure who the people are who are writing the research. Some journals I'm finding don't require people to identify themselves in terms of their education or current status. If they just might be a person from a certain institution in a certain country. But when I'm looking for nurse-led research, I run into a barrier there because I don't always know authors and names. That would be another point to consider in terms of publication and dissemination of your research findings, and that would be that it's important to choose a journal that is appropriate to your topic and to your particular profession, and that will get appropriate readership. More and more journals are what we call open source, and that means that you pay them to publish your research. So on the one hand, it might be easier to get your paper into print. On the other hand, we don't know yet about the quality of every open source journal. Well, we don't know about the quality of every journal, but open source journals are kind of new. So we want to be sure that we publish in a journal that's going to be seen and given credibility by the readership. Those are the points I wanted to make. Know your topic, love your topic, find a mentor, someone with whom you can be brutally honest at all times, and who will be honest with you as well. Try to work in teams if you're doing research, and seek out publications that are appropriate to your topic and that are credible, and that in which you would be proud to have an article appear. So I'd be willing to answer any questions later or participate in any further discussion, but those are the points that I wanted to make this morning. Thank you.
Thank you, Claudia. And I think because lack of time, we are proceeding, and I will ask Dr. Emmanuel Voisin, founder and CEO of Voisin Consulting Life Sciences. Please, the floor is yours.
Okay, hello everyone. Well, I'm not an expert in women's health. We are a consulting firm working with drugs and medical devices, and within the medical devices we do have eHealth products, quite a lot. So basically at this point I can definitely share what we do in eHealth, and I will be happy to participate in the main discussion later on. So first of all, I must say that we are very much oriented towards women. We are a member of WeConnect. We are mainly directed and driven by women in each of the countries where we're present. And this is 6 out of 8 countries. And we often get prizes for women as entrepreneurs. So we're really oriented towards this, towards women leading and women working for healthcare. In terms of what we do, we are bringing products to the market, and products are, like I said, medical devices and drugs mainly. And most of the time, those products are combination products, which is very interesting because there's always an algorithm or an eHealth product that brings the component and that really drives the combination product. For example, screening patients with an algorithm, screening cells that are taken out of a patient to bring back into the patient only the good cells. Whatever you can think of, there's bright entrepreneurs who have great ideas, and innovation always, most of the time, has eHealth in it, and specifically for women and in particular. So if we look into the products that we develop, we have a lot of CE marking and also 510Ks with the FDA. But what's most important to know is that today the main concern about digital health is really reimbursement issues. Therefore, there's market access to be worked on, and that is also what we do. Basically, I wanted to outline the fact that we have an innovation center within Voisin Consulting Life Sciences, which is called Neighborhood. And Neighborhood does mentoring, networking, and has facilities for their neighbors, who are the incubated companies. And within the neighbors, we have a couple who are in women's health, and that's important for us to mention. We have WOMED, which is helping with endometriosis. We have PhysiMed, and we have a couple others that are our neighbors. That is, we mentor them to bring their product to the market. Now, if you look at telehealth and women, what are the key points to consider? It's mainly contraception, abortion, maternal health, and mental health. And I must say that the first two are much more are topics for discussion and much more discussed all over the place than maternal and mental health, on which there is no controversy and everybody is more or less in agreement. And these issues are being raised in all parts of the world. So we definitely do have a major improvement in access to care for women. However, there's still hurdles on this, and a better regulation is needed for the care that is given to women, and that is something that needs to be worked on at the government levels. There is also an infrastructure that needs equality initiatives, meaning that women are not treated the same way in all parts of the world, and that is a concern. And finally, I would say that there are limitations. The funds are restricted, and we do need to unleash the funding towards women's health, and in particular, women's e-health. So basically, these are the main challenges. However, we can also open the floor on other key challenges in e-health that are more general, but do apply to women's health, which are data privacy, the safety of the e-product that we use. As I mentioned earlier, the reimbursement. There's also medical licensing, legislations and regulations. I mentioned that earlier. And finally, not to mention ethical issues and the importance of informed consent. So basically, at this point, I will stop and again be happy to participate in the discussion later on, although I'm not a specialist in the area.
Don't mind, you are a specialist, you are a woman. So that makes you, in a way, a specialist. But and now we proceed, and I see Professor Christine Hutzin, I'm not sure how to pronounce the name, who are the CEO of Health Sciences Enterprises Research. Please, the floor is yours.
Yes, I don't know if you receive my slides, but I can speak also like Emmanuel and Claudia. So Veronique invited me also to this panel because I've been inviting them to a publication called the Mini Symposium, trying to bring visibility to a group of women involved in technology and healthcare. And so Emmanuel and Rosa were participating, as well as Veronique, and we have a publication of this mini symposium coming out on March. So that's my contribution in a way to the women in the field of e-health. And I must say, like Claudia, I see my role in this as a woman that we need specific drivers, because it's very hard. So like you, I need a passion in some field of interest to sustain my activities, because we have limited funding, even if I have an academic track. And my key area is to try to combine business tools for renegotiation of welfare contracts. So bringing me to this group, and I could see the disparities, and I have, for instance, compare subjective and objective risk perception between women and men in cardiovascular disease, and I don't have time to show the differences, but risk perceptions are very different, and the level of knowledge of the disease is also very different. So I use the data analytics and model I do always comparing men and women and different stages of disease. The second role, I developed this tool, but I think for like men, we need strong education, and not only in business economics in my case, but also in pharmaco, in epidemiology. And in past eHealth event, I focused on controversies, scientific controversies between biology and geneticists. I had the previous session on digital biomarkers, for instance, and doing data analytics in healthcare using AI system and using advanced data mining techniques, face this issue that science is often provide evidence in development, and we have to be very careful also if we specialize in this field to have alert system on ways to report incident or to have incident report for both sex. Specifically for women, as I said, I try to help with publication because as an academic woman, I am in an editorial committee. And I see that in order to like Emmanuel, to have power base, I have a network with meetup philanthropists, and especially with HP. And not only to get HP equipment for my own work, but also because the CEO of HP was a woman and wanted to do something for women, and had the philanthropy branch in order to implement a new concept of a virtual development center. And I tried to use this concept of VDC, Virtual Development Center, for e-governance and e-network among scientists, and to translate research from academic, but not only academic research, like partnership or consortium of scientists, to translate to community. So it could be focused on community for specific needs for access to care to women. Now the need for networks, I strongly believed in that, so I created one in early 90s, which was an evaluation network for scientists to help policymakers in medicine policy. And then, because the research findings were very relevant for policymakers, I moved it to a spin-off for a technology and decision support system. And again, I faced the need for power base and joined women in science and women entrepreneurs in science and technology, because I found it was hard to establish and maintain and sustain research development. I provided an example of my work for IT propagation processes, and especially on primary care. And the key message I found is that, of course, security is a critical issue for e-services, and main limitation from physician or patient is resistance to social engineering. So it was discussed that a lot of people care in this conference about security and cybersecurity and a way to make it transparent using AI system, but there is a strong resistance. And when I look at the statistical model, I see that it has a lot of effect on the delay of propagation of electronic medical record or health record. Now, the effect on health plan and insurance, because access to care is depending on financing, and I could see with my modeling that on financial issues, the effect of health plans are mainly due to type of payments. So if e-billing systems are delayed, or if there are problem of lack of cash and no way to deal with that, then the e-governance is a problem. Now I saw also a lot of competition between the professional. We mentioned the physician, but the pharmacists were not always on the same ground of the physician. So the key area I'm working on, maybe relevant for this conference, is a technology platform like R2 protein platform, which is relevant for breast cancer. There are a lot of screening tests for breast cancer, but the issue on the scientific side is that there's a lot of false positive, and the result of the test so far is still a problem. So there's a 30% of false positive in the result of the test. So I tried to collaborate with a partner in Philadelphia on the diagnostic space of this R2 protein platform to see what can be done, and build a platform not only bench to bedside, but bedside back to bench, and try to identify some critical points that could help this false positive large proportion, which is nearly 30% of this problem. So this is my contribution, and I'm happy to discuss in the panel scientific issues. And the last message I want to say is that there's a need to address the fact that science is in transition. And so we need to be careful, and there is a need for process research to address this kind of controversy, reproducibility. There is no much incentive in academia, I can tell you, for to validate studies and spend more and more time because of the lack of funding. That's what I can say at this point.
Thank you so much. You did well without PowerPoint slides as well. But now we have the last virtual presentation, Ms. Rosa Maria Delgado, Disruptive Technologies Consultant. Please start your presentation.
Thank you so much. I have a presentation, but following everybody else, I will just speak about it. My name is Rosa Delgado. I'm an engineer by profession, consultant in new technologies, and I'm going to speak about that. Women, the natural leaders, don't worry, no, they shouldn't worry about so much about what they need to know, but instead they should know where they want to be and where do they want to go. As you know, as everybody know and have been talking, the healthcare has suffered an enormous transformation during the COVID-19. The crisis of COVID-19 has changed the way we live in an unprecedented way. No industry in the world evolving faster and more radically than healthcare. Governments and private sector has never before invested that much in research, digital health, and innovation. However, COVID-19 effect will remain for a few years, putting at stake health system, hospital staff, financial operations. So I think it's about time to exchange experiences and lessons learned and with the different regions, including the poorest of the world, about challenges and huge opportunities to develop further the healthcare. Today, there is still a lot of uncertainty. We have COVID, we have the war, but the good news is that more lives are saved because of the healthcare transformation during the COVID-19. Women in digital health, COVID-19 pandemic has provided a rapid acceleration of digital solution and business model. Women around the globe have been deeply affected by COVID-19. However, the inequalities that women face daily have been enlarged in both work and at home. Digitalization has transformed the healthcare system, but the adoption depends on each country They are rich countries and poor countries, so they really depends a lot on the resources. Automation and digitalization trends accelerated during the pandemic, however, have complicated the life of women. As the economy re-emerged, women past need to enhance, they need more education, they need more capacitation, the training, because the workforce has changed a lot. In hospitals, in industry, offices, and so they need to reskill or find new careers pathways. In rural areas, it's happening the same, where disease is prevalent, doctors, healthcare, and infrastructure are scarce and inadequate. We have to remember, and I hope we can use this, that telemedicine is an innovative solution to save lives, but an important thing that connects the developing world to the resources of the developed world. So the recession in developed world has been enlarged so much in 2 years of the pandemic that 20 years in reality. So all the developed country has a lot of knowledge, a lot of experience that need to share with the poorest areas in the world in order that it doesn't enlarge this digital gap. For example, developed nation has invested an average of 14% of GDP in the sector. Emerging nations, they don't arrive even to 3% and sometimes less than that. And even after the pandemic, not many countries are able to invest money in this digital assessment. We have to know as well that by 2025, McKinsey's, which is the largest company of consulting in digital way, is saying that Internet of Medical Things will generate more than 600,000 million globally. Artificial intelligence will generate more than 31 million. And the way like artificial intelligence is going, I think it will, in the next few years, will be really a #1 solution. The inequalities which women need to be addressed is the role of women in developing countries is not just being housewife, but also they are chef of the family. They need to contribute to the family budget. Women have less opportunities to get jobs because of the lack of education and cultural traditions as well. Women today are using more and more new technologies to develop personal and professional skills to work from home. And this is really a good way, like women really are tapping the way that to be up to date with new technologies. The internet may be able to support family union in the future. We know what are the health facts, the key health facts, cardiovascular diseases, often thought to be a male problem. However, it's the women #1 killer. Breast cancer is the leading cancer killer among women between 20 to 60 years old worldwide. 1 in 4 deaths among adult women are caused by cancer, diabetes, and heart disease. Worldwide, women live in average 4 years more than men, and girls are more likely than boys to suffer the sexual abuses. So we have a large expanded area where all these new technologies can really be adapted, can really be helpful to enhance the life of people, to give a quality life to people everywhere, not only to developed countries. But the problem is that 14% of the women are in leading position, only 14%. 30% of women are the only responsible for families in the world. 60% of the illiterate women, of the illiterates are women. 70% of the poor are women. 60 to 80% of all of that employed in the informal sector are women. So there is a lot of things that we need to enhance, and especially, you know, in the women area. I'm not also a professional of women areas, but I see that technology can really facilitate and enhance the life of men and women. But we need really the problem will be in the next few years, the investment, the education, everybody's mentioning about that, education, but also enhancing capacities. Women, for example, today, most of the hospitals, clinics, and telemedicine is going everywhere. However, people, they don't have the time to train people, they don't have the time to give more education. I think this is something has to be really decided between the industry and governments. I will call my recommendations, but in fact are my conclusions that measures which benefit women quite often bring the biggest social profit, equal participation of women and men in the development process of the country, of the industry, everywhere. Gender needs to be treated as a critical issue in shaping access the knowledge. We need to empower women with education, data-driven decision, tools, self-determination. We have to remember also that today the majority of systems that really data-driven decision, we have to enhance all the systems everywhere, in hospitals, in industry. We are changing definitely to a new world. 2 years ago, before COVID 2000, was really, the situation was completely different even in the industry. Today, we really have to know that the technologies everywhere has been enlarged of 20 years, 25 years. Look at that we have, and you know better than me that we have a vaccine that has done in 9 months, whether in the past was 9 years. So, and this is the use of artificial intelligence especially. The healthcare community needs to share experience among everybody in the world with the lessons learned, knowledge, challenges. The priority for governments needs to be to put telemedicine to shift from theory to reality. Data protection, private and ethical legislation need to be changed urgently in some countries to allow teleconsultation and other health solutions between patient and doctor. Thank you very much.
Okay, thank you for your excellent presentation. And last but not least, I have this local power woman who will have the mic next, Mrs. Hannah Ibrahim Abu Sharif.
It's working?
Is this working? Can you hear me? Can you hear us? So we have now here a presentation, Hannah Ibrahim Abu Sharif, Senior Nursing Informatics Officer, CEHA Abu Dhabi Health Services. I know that you work a lot of women and you have good ideas. Please.
Thank you very much for the introduction. My name is Hannah, and my experience, as you were all relating, had a women health experience. I was working breast cancer screening program for almost 8 years. I've been working with maternal and child health issues also again for 5 years. So I'm very common with all the women health issues. And as for the solutions, I will just reflect to what's being mentioned earlier, that our telehealth solutions were mainly focused on perinatal care and lactation consultations, because these are the main topics that's related to women health, and these are the major concerns for childbearing, and yet sometimes it's not being addressed properly at the level of the healthcare facility when they offer the service, where they just see the physician. This is as part of the patient facility, but from other perspective, having an experience of healthcare informatics or in the digital services, and right now we are calling it digital health or digital nursing, I would say that we need to, this time, to look into building the capacity for our team as nurses, having the awareness for minimal standards of health information requirements or health information security standards, because before the nurses were checking the patient's ID, verifying the patient identity as a patient identification method. But at this point, no, it's going to be an authentication from double side, and then you need to be careful when you're sharing the information on the data, and you need to be aware of all the tricks and tools or phishing or work that's happening on the computer science, which we need to be aware of. This kind of digital literacy is a requirement at this stage, and it's not only required for the health informatics team, it's a requirement as a basic information for all the nurses who are working in the healthcare. And I'm not saying only the nurses, all the females there, they need to be aware of this type of technology, and it's not for IT scope, it's for also any healthcare provider. They should have a minimal information part to know about that. I would say also, one of the things that is coming, and everybody, maybe it's not related to telehealth, but I would say that there is a social blueprints for the image of nursing, for the image of a woman. Like when you present yourself in the social media, you need to be careful of how you present yourself, because the way that you present yourself in the social media, with the interaction, whether if it's a Facebook, some people are posting things related to the patients, some people are posting things related to their work, and there might be some leak of information, for example, and some break of confidentiality, or even sometimes a risk for the patient or for themselves. This shouldn't be the case. They should know that they are accountable, and this piece of information is not belonging to them, and they can they should be aware of about that. They should not share it on Facebook, for example, or on Twitter. All these things needs to be taught and acknowledged at the level of entry point and for the existing staff, so that they can practice safely for the coming future. I think from that, that's from my side. Thank you.
Thank you so much. I totally agree with the Facebook and the social media issues. You must be so careful. And now we start discussions and comments, and I noticed that Anna has some comment.
Yes, hello everybody. Some of you know me. I have a question now. I'm looking at projects and at digital health, eHealth, also from the part of how can you finance it, because that is very important. Now, I have a question. We have now Claudia, who is from the English-speaking community, and then we have 2 French-speaking and 1 Spanish-speaking. What, especially from the Spanish and French-speaking women, what is your experience? How can you finance your projects? And I have the impression you can find funding possibilities more easily when it goes to the English-speaking projects. What is your experience from French-speaking and Spanish-speaking?
If you, Emmanuel, start first, and then Rosa Maria. Your mic is mute, please.
Sorry, I can speak for the innovation that comes from our eHealth and women developers. And I must say that these guys find much more funding in the US than in Europe in general. Now, I am not able to go to be more distinctive than that in terms of Spain, well, Spanish speaking or French speaking, but definitely Europe is funding with very little money, as opposed to the US that is always putting much more bigger amounts on the table to finance those startup companies that become later on larger ones.
Okay, well, myself, perhaps my situation is a bit different and easier in a way that I'm a consultant, so wherever I have a project, I'm contracted by some organization or private sector company. I actually coming from Peru, Latin America, and I know how much difficult it is to get, funding for projects for hospitals, for organizations. They are in in the health sector, and not only in the health sector, education sector, and everything. So I've been working for WHO with some projects, and I've been working with the World Bank in another project, and in areas of health. In other areas, I've been working with other organizations and private sector. But as I said, coming from Latin America, from Peru, is really sometimes the people have good subjects to develop, good subjects to bring to the community. However, the funding area is the problem. Governments not always help, their own research areas, and so they have to apply to research, to funding elsewhere. Normally in Latin America, it's the United States or some organizations, and where they get is today is very, very competitive. That's what they're telling me. The project, they're really very competitive because now so many countries are reeling, or so many areas or universities are doing so. So funding is a problem.
Okay, thank you. Claudia, you had raised your hand. Okay.
Yes, I agree with Rosa that, yes, as an academic, of course, I can say that there are a lot of tenders, of course, in digital health. But as she says, it's extremely competitive and consortium, so it's not accessible to a consultant only or to even small group, because I had my network with about 50 researchers, and that was not enough as a critical mass. So it was up to 300 people to be involved. So that's also a major hurdle. Even if they keep saying that they invest in digital health. So I agree that if you want some financing of project, it's the partnership that were discussed today on PPP seems a good way to go, because you can raise money not only from these tenders, which are highly competitive and discouraging, but also personally, I tried angel investing, and I signed some term sheets. I thought it was not a lot of money, but at least a way to move forward on a milestone of research. And that's more a business model from the US side, but it's not very welcome here, but in Europe, unfortunately.
Sounds interesting. And Claudia, you raised your hand earlier. Do you want to say something?
Yeah, I don't want to cut this conversation off, but we only have limited time, so I wanted to ask about a different topic. And Rosa mentioned artificial intelligence as being something that's relatively new, but has great potential for research and, in my case, healthcare. And I wondered, of all of you, where you see us in terms of artificial intelligence. For example, are there women who are involved in its research or its development or its application? And are there we have a pretty good worldwide representation here. Are there any women who are particularly leading in that area of artificial intelligence?
But I think that in many cases, the women must be visible. They must be in certain groups of society so that they can raise their voice and be active. Of course, I understand that the women, if they are pregnant or having children, it's a little bit different. If I think about the traditional model, in some cases, in Finland, for example, the male are staying at home and female are going to work. But it's not in many countries. But do you have? Okay. So do you have any comments so far? Oh, yes, Hannah.
I just have a suggestion. I had an experience where when I wanted to establish the nursing informatics specialty, I wanted to market it. Now, not everybody was welcoming that. And they say, why would we adapt and build that kind of domain? I wanted to have a return of investment to the concept of our executive level. And from there, I linked or I digged up into the financial impact of nursing documentation into the claim or into the billing. And from there, we learned the rules that if we aligned with that, we can get a better claiming or better reimbursement for our nurses' documentation. And based on that, we said, now the nurses' informatics or the nursing documentation has an impact. And from there, we got the justification for the nursing documentation or the financing. So the financing would come from the insurance, learning their rules, what's required as a verification point for patient history, for the CPT codes, and from there we can have a full claim. I have a full dashboard which is related to nursing procedure that I built, and this is one of the ideas that we can prove to the executive level by data that we can contribute to the overall patient claiming. It's not only ICD-10, which is identified by the physician. It's also the CPT codes that is linked to nursing practice and documentation. From there, I think this is a good point to start with so that we can defend our position as nursing in health IT, and we can bring the point to our work. That's a suggestion only.
But I think a good suggestion, and also I will continue because I think it was nearly 20 years ago when I started Master of Healthcare Technology, and at that time the employees didn't even know, so they hired nurses, and nurses want to have more salary when they had studied more. And luckily in Finland now we have, I'm coming from Finland, we have a PhD, master's and bachelor level in nursing informatics or whatever you call, but anyhow nurses can end up and they can have new job opportunities. I think that is, I think, the main thing, and also that the working life should recognize that nurses, if they realize new modern studies, they should be rewarded. They should have salary check up and so. And also, as an entrepreneur, I think that the women have to do more than male in some cases, because traditionals, when I started 3 decades ago in this nursing informatics or digital health or telemedicine, I was quite often only woman among men, because it was the world of men. But now it is multidisciplinary. Nurses have their own knowledge, their own science, and I strongly advise all people who are involved that they should make their work visible, write publications, and be part of the different projects. But I saw that, Rosa, you have a comment, please.
Yes. Yes, I agree fully with what you're saying, because that's what I mentioned before. We need more women in the top level, the higher level jobs, because they understand the situation, what's happening at work, what's happening in your own career, in your own sector as well. And even I see more often the idea of doctors, medical doctors that study medicine, but also they study digital areas, management, because we need all of these areas. Today we cannot work just in one part of our career, but we need really to be multifaceted. We need to understand, but also sharing information. If you have this type of problems, if you have this type of ideas, I think we have the networks, we have the Facebook and all of these social networks that we have to really start to share information and make public all of these problems, because sometimes people do not realize at all. So I think it's also the matter of reskilling as well. Some nurses or some doctors following different careers and really working together, that's it, and sharing information and making sure that the problems are solved. And this is fantastic for that. Internet, we can find information, we can find people that are talking about in other countries. We have to also to be, multifaceted in the way to share what's happening in one region, in another region, because we may have the same problems. We may we may have the same solutions. I think it's fantastic for you. This is really a way that we need more education, we need more trainings. Thank you.
Yes, and I think that some of you mentioned about the COVID accelerating the digital use of digital services, and in Finland we did a study how the patients or clients reach out the healthcare professionals, and the nurses were the biggest group, nurses and public health nurses, and it was really a kind of push that we should do something, and as educators I think we have done. So we have created, and also in medical staff we have now specialized studies to medical doctors as well. But I think that due to this pandemic time when we favor those digital tools, that's a kind of, not a challenge, that possibility to women to be part of this healthcare chain and also develop their own work. That's important, that when you learn new things, you adapt it. And you have to leave something behind. You can't have all the work. Do it the traditional way and the modern way. You have to find the way how to work in a smart society, if I may say so. But do you still have comments for us, or?
Well, maybe I can, let's see. I can add something about women in artificial intelligence, because I'm a member and leading the policy development working group of the Avicenna Alliance. And within this Avicenna Alliance, which is aimed at promoting in silico research and in silico medicine in general, a large number of members are coming from VPHI, Virtual Patient Institute, and this is led by a woman based in Belgium who is extremely famous in silico research. She's an academic, Liz Garrett, Professor Liz Garrett, and she is really leading that initiative with a lot of success and putting together, putting eHealth into drug development and device development for the benefit of the patients at the end of the day. Of course, it's academic, so it's early on, but at some point there will be applications, and she will succeed in bringing drugs to patients much faster and much more efficiently. So we do work together quite a lot.
Thank you. So I would like to add something. When we talk about digitization, we need to acquire new tools and systems which will eliminate all the manual works, which will help nurse, first practitioners, and also administrative employees. So we will improve our system by deploying the more sophisticated ERP or software to make a room these practitioners and nurses to do their job very upper level perfectionism. Because when we deal with the paperwork in today's world, it's not easy to keep up with the change, evolving. And this digital world, this is demanding world. During this time, evolving this kind of changes, taking in good hand, and giving more sophisticated system to the users in hospitals, universities, in healthcare, any organization, which will help the people do their job in perfect level while they are improving their skills and education, because they will have room to do some other personal improvement time instead of doing manual works and paper works while they are using the system properly. Thank you.
Okay, time flies. I thank you all for the excellent ideas and sharing your experiences, and I'm convinced that the discussion continues. Thank you all. Bye-bye.
Bye.
Thank you.
Bye-bye.
Bye-bye.